So what can we as parents do?
One of the things you can do is to educate yourself around what the risk factors and the warning signs for suicide are, and to raise your level of alertness around your young person. And here I just want to draw a distinction between the risk factors for suicidal behaviour that I've just talked about and the warning signs of immediate risk. And maybe one of the ways to think about this is, if you think about a physical health emergency, probably the biggest emergency is a heart attack. And we know that the risk factors for a heart attack are lack of physical exercise, obesity, being overweight, high cholesterol levels. But the warning signs of a heart attack, if you think of the television programs that come on from time to time, the warning signs of a heart attack are crushing chest pain, maybe radiating down the left arm, breathlessness, palpitations, nausea, sweaty, those sorts of things. They indicate an imminent risk of an immediate risk of a heart attack. Now, if you look at suicidal behaviour, the risk factors are difficult time in childhood, mental health problems such as depression and anxiety and substance use, ready access to lethal means, those sorts of things. The warning signs are someone talking about suicide, looking for methods of suicide, asking people what are painless ways to die or to kill yourself, changes in behaviour that are noticeable, such as sleeping more or having difficulty sleeping, isolating, withdrawing, a decrease in school performance, not going to school, decrease in performance at work, or going to work and not performing to their previous capacity, dropping out of sports teams, stopping doing things that they used to enjoy doing. Those are the warning signs that parents need to be aware of and respond to. Probably the most important one is young people saying or suggesting, because they may not say directly that they're thinking about killing themselves, they may say it indirectly, but being very alert to that. So someone who says, I don't see any point in living with all of these problems in the world. Don't even bother buying Christmas presents for me. I'd be very worried about that, and I would pursue it further. Someone who may be in the workplace and says, don't bother putting me on the roster after Christmas. I've got my life sorted. And you know they've had a few problems. I would pursue that. And it's just raising your level of alertness and vigilance around things like that. Also, don't monitor your children's activities as much as they will let you. Do things with them and know what's going on in their life. And remember, at this time in their life, they're trying to establish their independence from their parents. So there may be some pushback from that, from your efforts to get involved in their life. But it is really important that you try to do that. It is very important to keep telling them that you care about them, love them, and that's particularly important for dads to be involved in doing that. Be alert to other changes in behaviour, such as drug paraphernalia, nooses under the bed, pursue that sort of stuff, getting pills from grandma's bathroom cabinet or something like that and accumulating them. And always ask young people and pursue the issue. Don't hope that it's so scary it'll go away if you ignore it. You have to ask young people directly if they're thinking about killing themselves, if they're thinking about suicide. Don't be afraid to ask directly. You're not going to put the idea of suicide into their head by asking them. And in many cases, they're actually grateful that you've raised the issue and given them an opportunity to say, yes, that's what I'm thinking about. If they are thinking about suicide, never ever ignore them talking about suicide. And that's really difficult for parents, because kids learn really quickly what presses parents' buttons. The problem is that there is it's much more common for young people to say, I'm going to kill myself, then, and it's talking about suicide or thinking about suicide is much, much more common than suicide attempts or suicide. And there is a tendency for people to dismiss it because it's common. The problem is that even though the vast majority of people who talk about suicide or think about suicide are never going to make a suicide attempt or die by suicide, amongst the people who die by suicide or make medically serious suicide attempts, most of them have actually talked about suicide. So bottom line is that you absolutely cannot afford to ignore someone talking about suicide. And remember that with young people, they're using it as a communication of distress. And you have to drill down and find out what it is underneath that's actually causing that distress. If you don't sort that out, they will continue to use, I'm thinking about suicide as a communication of their distress.